It seems like a lifetime ago, doesn't it? On a scale of 1 to 10, I hope you're rating yourselves at least an 11 under the category of pride and accomplishment. Give yourself a 7 regarding sense of relief because you still have that NCLEX to do. Two thoughts of advice that I'd like to impart to you tonight are: 1, let us be your stepping stone, and number 2, that you are an individual but also part of a greater whole. As part of a bigger picture, know that you will be called on to be both an individual and part of the bigger picture. There are times when you will be a soloist and times when you are one of many instruments in the orchestra. There are times when you will be judged by the collective actions of the nursing profession, and there are times when your individual nursing actions will result in judgment by others on the profession as a whole. Let us be your stepping stone. Do not mistake a sense of accomplishment as a sense of finality. The completion of your Associates of Applied Science in Nursing does not mean the end of your education, but rather the beginning of your nursing career. For if it does not, then we in fact have not accomplished what is included in both the nursing department's philosophy and the mission statement of the college, that of lifelong learning and professional development. It takes one nurse to insert an 18-gauge IV in a patient's arm. It takes 2 nurses to follow the standard protocol for safe blood administration to a trauma victim with internal hemorrhaging. It takes more than 20,000 nurses, paid and volunteer, to provide Red Cross services, including promotion of blood collection, as well as serving on disaster action teams. CCM nurses serve on both volunteer and paid capacities in the Red Cross. Nursing care at Morristown Medical Center, a 639-bed facility, is provided by over 1,700 full and part-time nurses. There are 35 admissions annually, including 12,000 inpatient surgeries, 3,700 births. But the wife of the 49-year-old father of 4 in the ER, complaining about the elephant on his chest and pain radiation down his arm, is concerned only about the skill of the nurse at her husband's bedside. There are many CCM nurses working in the emergency services at Morristown. My 89-year-old mother can verify that fact, and she loves them all. It takes one nursing faculty member to teach, guide, and then observe a student safely administer their first sub-Q injection to a real-life patient. It takes 16 full-time nursing faculty and 10 clinical instructors to educate 300 students each semester in the professional phase of nursing. Several of these faculty are CCM graduates. Nursing is a service profession. There are 12,000 nurses that feel an additional call to service in the form of duty to their country and serve as officers and reservists in the Army. We have military veterans who choose nursing as a career and are currently enrolled as students in our program. In addition, we have CCM graduates who decide to serve our country in this capacity after graduation and enter the military after obtaining their nursing degrees at CCM. As one nurse, you will see patients denied needed care due to lack of insurance coverage. You will come across patient care services that you know can be better. The status quo may seem overwhelming, and you may feel helpless and perhaps even angry. But there are 3.1 million nurses today in the United States, and tonight there are 60 more, all CCM graduates. Do not tell me you cannot make a difference. So I challenge each and every one of you to make a difference. Each of you will make a difference in your own way. It may be at the bedside as someone takes their last breath as they leave this earth, or in the delivery room as another makes their first cry as they enter this world. And so, although in the beginning I referred to you as students, now, as a representative of this nursing faculty, and more broadly as a representative of our profession, I say to you, colleague, fellow nurse, welcome. Come. We have anxiously anticipated your arrival, and you are much needed. Join us on this challenging, exciting journey. Welcome. Congratulations to the profession of nursing, and I am so proud to introduce you as 60 great, wonderful CCM nursing graduates who I know will make a difference.